Hello, and welcome to our TED Talk. We are group number 9, and we are here to discuss our AT Education Community Project, which is about magnesium. For our intervention, we designed an educational course based on a CME to help clinicians better understand social media trends. We wanted to focus on a very popular TikTok trend at the moment, which is magnesium supplementation, to prepare clinical leaders on how to care for patients coming into their office, asking certain questions about magnesium use they've seen on TikTok and other social media platforms. The idea for our intervention was to create a CME-style module focusing on viral health trends, in our case, magnesium supplementation, which included several evidence-based literature reviews and information about the popular trend. Since social media is such an integral part of many people's lifestyle these days, we thought this type of intervention would be a good starting point for the development of future modules focusing on other viral trends over time. Our statement is this: an educational gap exists between patients who access health information on social media and their healthcare providers' ability to respond based on evidence-based literature and practices. Since social media is growing so quickly, it's inevitable that a medical provider will have a patient inquire about a health trend they've seen on social media, and they may lack the knowledge on how to address their questions regarding the trend at the time. This knowledge gap will lead to missed opportunities for meaningful patient-provider interactions and ultimately misinformation about the viral trends. The evidence is this: content creators on TikTok, Instagram, and other social media platforms encouraging their followers to use magnesium supplementation, typically without providing any legitimate evidence-based research as to why. There are hundreds, if not thousands, of videos about magnesium use available on public social media platforms. A survey done by the New York Post found that 2 out of 5 people have used online information and are more likely to self-diagnose instead of seeing their medical provider. An interview we conducted with David R. Craig, a clinical professor of USC's Annenberg School for Communications and Journalism, taught us that people tend to gravitate towards content creators who are more easily accessible than their medical providers, who they don't have as trusted of a relationship with.
Our community partners included the USC Annenberg School of Communication and Journalism. We had the opportunity to interview David Craig, clinical professor of communication and director of global media, who helped us explore the multifaceted relationship between influencers and their audiences. Professor Craig's expertise lends a scholarly perspective to the intricate role of social media within healthcare and the potential for influencers to become advocates for evidence-based medicine. Our intervention is a 45-minute pre-recorded Canva presentation that included a pre- and post survey in the style of a CME. It focused on magnesium supplementation, the alleged benefits touted on social media, and evidence-based literature of the claims. It was dispersed to clinicians for viewing, with data analysis conducted on the survey results. The course focused on social media, a research discussion, nutrition, patient education, and takeaways. Our literature review topics included sleep, learning and memory, dementia, migraines, obesity, diabetes, depression, anxiety, ADHD, dysmenorrhea, PCOS, PMS, menstrual migraines, pain, fibromyalgia, and smoking cessation. All these topics were included in various social media posts with claims magnesium supplementation could treat and in some cases provide a cure. Another important part of our module was the epidemiological research on certain special populations regarding magnesium intake. To help patients receive the best care, we wanted to provide the community clinician the research regarding the nutritional needs of diverse communities they see in their practice. Some of these communities included African American, South Asian, East Asian, Hispanic Latino, Iranian, and LGBTQ+. Providing an educational module focused on bringing viral health trends back to the community clinician not only allows clinicians to provide evidence based recommendations to their patients from a trusted source, it also allows clinicians who are not active on social media to participate in the conversation and remain up to date with current trends their patients may seek guidance on.
Now, let's talk data. First, we asked ourselves, in what context do we frame the data that we collected? We started by setting concrete objectives that were 1, actionable, and 2, measurable. The actionable aspect came from our idea of creating an educational module that covered various topics regarding magnesium. We wanted to find out if our educational module increased people's knowledge of magnesium's effect on their health, with objective 1. With objective 2, we wanted to increase people's knowledge of magnesium-rich sources, both dietary and supplementary. And lastly, with objective 3, we wanted to increase people's awareness of social media trends and what their impact is on the population as a whole. We ensured that our module included information covering these objectives. The measurable aspect prompted us to develop pre and post surveys so that we can analyze each person's baseline knowledge of magnesium in the context of the objectives I just outlined. The post survey was then to be answered after each individual reviewed our module, and we hoped to capture data that reflected an improvement in knowledge across the objectives that we set out to achieve. And just to clarify, the pre and post survey questions were exactly the same. Now, let's focus on objective 1. We created 3 pre and post survey questions that we can measure this objective with. The statistics presented are combined data from each question. Objective 1 was to increase the general public's knowledge of magnesium's health effects, and we created the 3 questions regarding magnesium supplementation uses, deficiency side effects, and overdose side effects. In the pre-survey chart below, there are 0 participants who were very familiar, which is the dark blue color, with the questions posed. But that very familiarity dark blue piece of the pie chart increased to 35% in the post survey after viewing the module. In the post survey, familiarity in orange increased to 57% from 41%. Participants who were unsure of the data in gray decreased in the post survey from 20% to down to 3%, and little familiarity in yellow had decreased down to 5% in the post survey. For objective 2, we created 2 pre and post survey questions that we can measure this objective with, regarding familiarity with non-dietary sources of magnesium and familiarity with foods rich in magnesium. As you can see by the charts below, the pre-survey data, there were 0 participants who were very familiar with the questions posed. But that increased to 43% in dark blue in the post-survey after they viewed the module. Familiar statistics in orange increased from 27% to 49% in the post survey, while those who were unsure in gray had dropped off to 0% in the post survey, and little familiarity in yellow shrank down to just 8%. For objective 3, we posed 2 questions to measure this objective. However, only one question was relevant for the pre-survey, but not the post-survey. So the data from that question was not used for these charts and is highlighted in red. The data collected with the one question used shows an increase in the very familiar category in dark blue from 15% in the pre-survey to 43% in the post. Familiarity in orange increased to 40%, unsure in gray decreased to 5%, and little familiarity in yellow dropped to 0%. Not familiar in light blue decreased to 10%, all in the post survey. To sum it up, our data across all pre and post surveys had an increase of answer choices, very familiar, and a decrease in the answer choices unsure, little familiarity, and not familiar. Now, let's speak about sustainability. In our post survey, we included the question, What other health trends have you seen on social media that you would like more information on? Some of the responses we got were supplements, intermittent fasting, castor oil, neurotrophic mushrooms, melatonin, testosterone boosting supplements, creatine, among other things. The improvement in knowledge, as evidenced by our survey statistics previously, and the strong response rate to our post survey write in question, it tells us that our viewers are curious about trending healthcare topics and that educational modules like ours is an effective teaching strategy for the masses. This can also be easily adopted and retrofitted towards other topics.
Hi, friends and fellow healthcare advocates. Up until now, we've taken you on a journey of our group project's transformation and our CME to empower us as future healthcare providers. By recognizing the power of education as a catalyst for change, we created a CME for our colleagues with the knowledge and tools needed to navigate this TikTok social media health trend that's, well, taking over our social media feeds and seen readily within clinics, starting with Magnesium. So imagine you're scrolling through your social media feed, TikTok, Facebook, Instagram, maybe MySpace, and suddenly, ba-bam, you're bombarded with all these healthcare trends. Magnesium this, Ozempic weight loss that, and oh, what about that whole mouth taping for better sleep? Instead of feeling overwhelmed, we decided to take matters into our own hands and tackle this head on by doing the heavy lifting. Because let's face it, in a world overflowing with health information and limited patient time, healthcare providers are often left scratching their heads, wondering where to even start. Our team aced two things. The first being diving into evidence-based medicine for our CME and laying a solid foundation for others to follow. Our long-term goal is simple and possible. Streamline this project with consistent leadership and rotate specialties for effective information sharing. We also led a CME initiative, mixing interactive sessions on magnesium's role in medicine. Our ultimate mission? Empower providers as EBM champions. We dived into research, crafted engaging content, also linked this to online trends with science. So what are our next steps? Refine strategy and focus on specialties. Spread health trend awareness. Brace yourselves, because social media healthcare trends aren't going anywhere anytime soon. Our CME platform is here to shake things up. Picture this, a world where patients and doctors communicate effortlessly, healthcare information is readily available, and everyone makes informed decisions. We're not stopping at version 2.0. We're consistently looking for ways to level up and to sustain this vision. We're thinking about introducing fact sheets for patients and providers, exploring online learning opportunities, and hey, how about creating a social media analyst role? The possibilities are endless, and we are all ears for fresh ideas as new topics emerge. In today's online world, we are swimming in healthcare information on social media. It's everywhere. But reliability? Well, that's a bit of a tricky one. So before we wrap up, let's rewind a bit to the classic 1990s Kevin Costner blockbuster movie, Field of Dreams. Remember that quote? We're not exactly talking about baseball fields today. We are talking about building bridges between what patients know and what providers understand. Our team, a bunch of fired up PA students with a mission, found ourselves facing a similar challenge in our own field of dreams. We saw a major issue in healthcare, a gap between patient knowledge and provider understanding, especially with all the chaos of social media trends. We envisioned what healthcare could look like, so we took on the opportunity to shake things up. But how do we actually make sure this idea works? How do we bridge the gap well? Step one, we create a trusted online space where healthcare professionals and patients can share knowledge and learn from each other. It's not just about talking, it's about building trust and working together. And what about making sure the information shared is accurate? That's where our second plan comes in. A team of experts will check healthcare information on social media and explain things based on evidence. It's not just about having qualifications, it's about giving patients the right knowledge. Being great at CME isn't just about completing tasks, it's about getting involved. So our plan involves including feedback, making programs that fit different needs, and using fun teaching methods like interactive simulations and also workshops. With these steps, our CME can improve and learn from what both patients and providers need. But we can't do this alone. We need help from the community. We want to partner with influencers and platforms, providers, to share reliable information, debunk myths, and reach over more and more people over the years. It's not about teaching, it's about getting the patients more power and knowledge. It's ultimately clear that there's a lot of healthcare information on social media, which can be overwhelming. But here's the thing, if we focus on bridging the gap and improving patient-doctor interactions in the ever-changing role of social media healthcare trends, we can make healthcare easier to understand for our patients and improve healthcare options. So our CME platform's sustainability relies on not just scrolling through trends, but also focuses on patients and doctors who can work together to separate fact from fiction. It's a collaborative journey where every share and post guides us towards a healthcare landscape where reliable information reigns supreme and is easy to access and understand. Thank you for your time, and we hope you'll think of joining us to bridge the gap and improve healthcare for everyone.